I was diagnosed with diabetes here 20-some years ago. I had had an interest in medicine early on, and then I got diagnosed with diabetes. And like a lot of people with diabetes, you'll find in pretty much all endocrine departments, you'll have a couple people that are type 1, or they'll have a sibling or someone who had type 1 diabetes. One of the cool things about diabetes is that you get to take care of kids both acutely and then long term. So acutely, kids come in and they're sick and they're scared and those things, and we get to help them in a time of crisis at times and be there for them. The resilience and the attitude of kids amazes me every day.
Why do people get diagnosed with diabetes?
That's a really good question. Diabetes and endocrine is good because you get to develop that relationship with families and follow them sometimes from birth till, adolescence or adulthood. And there's times where you get to kind of discharge kids from your practice when they turn 21 and, you've taken someone from being a young kid to an adult, and that's a pretty cool thing. A team taking care of a patient with diabetes is really important. Communication between visits is really important. And I think one of the things that I see here is we have great support staff. So the physicians and the nurse practitioners that see patients in clinic are really important, but just as important is social work, nutrition, psychology. For type 1 diabetes in kids, the technology is getting better and better. Diabetes is easier to manage now than it was even 10 years ago. The technology with continuous glucose monitoring and insulin pumps, and then actually faster insulins too, to mimic the insulin in our body. I want my patients and families to know that they're going to get excellent care here at Nemours. So we're going to get to take the time to get to know them really well and take the time that we need in the office visit to address their concerns and give them the best care that their child deserves.